Good day, I am Hannah and today I am presenting a commentary article I had previously written. This is entitled The Treatment Outcomes with a Widely Used Invisalign System. At the present time, a growing number of adult patients seeking orthodontic treatment do so for aesthetic reasons. As mentioned in a particular study, most of these patients prefer more aesthetic treatment options such as lingual orthodontics and Invisalign appliances over label fixed appliance wear. In this presentation, I will be discussing the different treatment process and treatment outcomes of using the Invisalign, whether it would be worth investing for in a patient's viewpoint. First, we will talk about the treatment process in Invisalign. Specifically, I will mention the advantages and disadvantages. So accordingly, Invisalign provides increased comfort and aesthetic appeal. It is even removable, which definitely gives a comfort to the patient. However, they may not be as effective as traditional brackets, especially when cases become so complex that there is too much discrepancies in the occlusion and too much crowding and spacing. Hence, as suggests, the Invisalign appliance may be a treatment option for simple malocclusions, but it has limitations. Now we'll talk about the positive treatment outcome. According to a study, patients treated with Invisalign have better periodontal health, oral hygiene, and lower oral bacterial counts than the braces wearing counterparts. There is also lesser discomfort. Treatment period for clear aligners may also be shorter compared to traditional brackets. As for the negative treatment outcomes, there has been at least a little finding. One of the most frequently affected functions in orthodontic treatment is speech. A study found that speech is greatly impacted by Invisalign clear aligners, and after 2 months of treatment, a patient's speech doesn't return to baseline despite some degree of adaptation. But overall, that's fewer than the positives, right? So now I am sharing you my personal insights if I were the patient, whether I'd consider having Invisalign or not. So the Invisalign equally has its positive and negative treatment outcomes as well as advantages and disadvantages. I would say it is worth investing if I am so conscious with appearance, if I have mild teeth discrepancy, if I have the money, and if I am aiming for a faster treatment duration. On the contrary, it is not worth investing if I have heavily misaligned teeth. If I am not compliant or if I have financial constraints, thus I would opt for the fixed label appliance. Though oral hygiene outcome is more favorable in Invisalign than the latter, I would still opt for fixed label appliance if the true goal is the correction of the heavily misaligned teeth. Now, why am I discussing this? Well, basically taking a look at current trend, studying out its treatment outcomes, the findings can definitely give impact. It can be used to make research more on this specific topic, and one day advancements can be made. Thank you so much.